I'm going to put that in the side of his mouth, and I'm going to look at the buccal mucosa. I'll do the same thing on both sides. I look at the gingiva, and it's a little hard to see because he has full dentures, both upper and lower, but they seem to be nice and pink. His dentures are in good repair, and I'm going to ask him to lift his tongue and look under. Yeah, there we go. Tongue and lift in sublingual area. I don't see any edema in the salivary glands. It's nice and pink. He says he has no pain there. I can't see his hard palate because he has his dentures in. And so I'm going to ask him, does he have any discomfort under his upper plate? And he tells me no, he does not. Now I want him to stick his tongue out and say, ah, and I need my light, it's dark down there. I'll look in there, he says, ah, and when he does, the uvula vibrates. I forgot to say that earlier. And that's the response you should see.
That's a little piece of meat in the back.
That's that little punching bag thing in there, yeah. And I don't see, he's had his tonsils out, the back of his throat is pink, there's no redness, there's no drainage, and that seems to be in good repair. So, we know that about Manny's mouth. I'm going to palpate his tonsillar area, and I'm not seeing any reaction with frowns or grimaces that's painful. He tells me it does not hurt. I've palpated the sides of his neck down the edge and clear to the back of his friend. I don't find any enlarged nodes, and they don't seem to be tender at all. His pulse points are sure it is. What is that? Temporal. Yes, there it is. Lost 2 words today. Temporal pulse and his carotid. I feel temporal on both sides. I never want to palpate the carotid arteries at the same time. That would cause, it would occlude blood flow to the brain and he would pass out. So, but both carotids are palpable, his brachial arteries and his radial artery here. I'm going to palpate his radial artery on both sides. They seem to be equally paced and strong. His femoral artery, I'm going to ask him to lift his leg up, and when he does, right where his leg bends is where I am going to push down, and if I do, it's going to push it against the bone, and that's where I'm going to feel the femoral pulse. I'm going to palpate the popliteal pulse. Behind the knee, that's one that is very hard to find. You're going to have to practice that, and you're going to have to get skin on skin. Okay? And then there is the posterior tibialis is present, and he has a strong pedal pulse. That's his pulse. And while I was doing that, I also observed that his skin is nice and pink. It's moist. It's smooth. He has no edema. So his skin is in good shape. Okay. We've looked at his ears. We've done a lot here. Yeah, all right, the vascular, I'm going to do the do capillary refill, and he has return in less than 3 seconds. His skin again is warm. The color of his skin is pink. He has no edema in his hands. He seems, if he makes a fist, he can make a nice tight fist. It's not one that's has a lot of edema in his fingers, and he can't make a nice tight because his fingers won't bend with the fluid. So he has that. We've got the radial pulses, no edema. And do you have any pain, numbness, or tingling in your fingers? Can you move those for me? Yes, he can do that. So that's what we wanted to know about that. I'm going to ask him, I'm going to put that up just a little bit. I want to listen to your chest, Manny. This is your lucky day. You getting along all right with that tracheostomy? Is that helpful for you? Uh-huh. You can breathe a lot better now. You heard him say that, didn't you?
Did.
Okay. I'm going to begin on the left side, and I am going to listen to his anterior chest. There's the first place. For the second place, I'm listening above the clavicle so that I can hear the upper lobes. There's 2, 3, 4, in and out, 5, 6, 7, and 8. I'm going to ask Manny to sit up. Hold him over there with your other hand. I got him. I'm going to listen to him on the left side, above the scapula. And I'm going to listen over here, 2, 3. I'm asking him to breathe in and out through his mouth. 4, 5, 6, 7, 8, 9, 10. He's heavy. And so he has good breath sounds in bilaterally in all of the lobes. Yeah. Okay, there you go. Glad they put that in. That helped you a lot, didn't it? Yes, it did. Now I'm going to listen to his heart sounds next.
We don't have to do the sideways?
Oh, yeah, I do. Bilateral. Okay, where's your I forget those all the time. Okay. There we go. Right under the axilla. Is 1. I'm going to come down a ways, just a little space, about the width of the stethoscope. 2. I'm going to come forward 3 and back 4, a little lower in line with the 1 and 2. I'm going to do that bilaterally. So now I can say he has good breath sounds on in both lungs, all of the lobes. So we have done that, and here the aortic valve. We've done that. I'm going to inspect his abdomen at this point. You're getting a real carnival ride this afternoon with this bed going up and down and bending and straightening out. This is the next to the last move you're going to have to make here. I know, you'll be glad. And that's over. Okay, there's his abdomen is exposed. I see that he has a dressing. It's in the midline. It's a 5 by 9 ABD pad. It is dry. There's no drainage on it. And it was changed not very long ago, just a couple of days ago. tells me he's in no pain. I don't see any other scars. I don't see tattoos. And I guess that's all I want to know about that. I am going to begin to listen to his abdomen in the lower right quadrant. And I hear belly sounds there, upper right quadrant, and I hear sounds there. Upper left quadrant, I hear sounds now. Lower left quadrant, and I hear sounds there. If I had not heard sounds, I would need to listen to each quadrant for a full 5 minutes before I could declare that there were no bowel sounds present, which means that in that quadrant and for the entire belly, it would be a total of 20 minutes I would need to listen before I could say there are no bowel sounds. So the way I would chart that was bowel sounds present times 4. That takes care of the auscultation, and then he told me he had no pain, so I'm going to begin my palpation in the lower right quadrant. I'm going to move up in the line of the colon, the ascending colon, across the belly in the descending colon. I'm going to be careful of his wound that's there. I'm going down the descending colon. I don't notice any discomfort or expressions that would indicate that was a tender belly because of the palpation. I didn't feel any masses. If he had not had the dressing on there and I was palpating the whole belly, I would probably chart it as the belly is soft and non-tender, which is a normal belly. I'm going to go on down and I'm going to look at the scan again of the legs. I'm going to do the vascular check again. I'm going to do capillary refill. I'm going to check losing his foot. You gotta hitch your get along, buddy. There, I'm going to ask him to point his toes up towards his chin. I said, do you feel any pain in the calf of your leg? He tells me no, he does not. Since I can't compare leg to leg if he had pain, but he has no edema, no redness, no tenderness. He's warm, he's pink, and he has no pain, tingling, or numbness, there it is, in his feet. His skin is in good shape there. And so I am ready to conclude this. I'm going to tidy up his bed and his room. I'm going to ask him if there's anything I can get for him. He has his teeth, has his glasses right here, has his TV remote, and he doesn't need any pain. He has no need to go to the bathroom right now. And so we're in good stead. There's his call light, and I'm going to put his bed in the lowest position. I looked at his trach, and the bladder on his trach tube is inflated. That tells me that the collar inside his trachea on the end of the trach tube is inflated and the way it should be. We're going to raise the head of his bed to accommodate his oxygenation because he does have the trach. And ask him if there's anything that I can get for him, do for you, do with you. And yep, lunch will be along just soon. Yep, it'll be here. You're going to like it today. It's good. I've already seen some of it. So, that's it.
Okay,
That's amen. Amen.